Hey guys, this is FixerMed. Welcome back to my high yield anatomy review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. This will be part 11 of my multi-part video series giving a broad overview of anatomy for these exams. So without further ado, let's go ahead and get started on today's content. I'd like to start off by talking about what a superior gluteal nerve injury is. Superior gluteal nerve injury can result from surgical procedures, posterior hip dislocation, or conditions like poliomyelitis. This injury leads to paralysis of the gluteus medius and gluteus minimus muscles, impairing the ability to lift the pelvis and perform thigh abduction, abduction. Notably, if the nerve is injured on the left side, the right pelvis descends when the right foot is raised, indicating an effect on the contralateral side of the body. Moving on to the next concept. Injury to inferior gluteal nerve. Damage to the inferior gluteal nerve manifests as diminished hip extension, primarily affecting the gluteus maximus muscle. This weakness is particularly evident during activities like ascending stairs or transitioning from a seated to standing position. Common causes of this injury include posterior hip dislocation or surgical procedures in the region. Moving on. Avulsion fractures of the hip bone and hamstring muscles. Avulsion fractures occur at the sites where muscles attach, such as the ischial tuberosities. The hamstring muscles include biceps femoris, semitendinosus, semimembranosus. These muscles collectively perform the actions of extending the hip joint and flexing the knee joint. The nerve supply for the hamstrings is predominantly the tibial nerve, although the short head of the biceps femoris is supplied by the common fibular nerve. Moving on to our questions. So we have a patient that presents with weakness in lifting the pelvis and thigh abduction following a surgical procedure. Examination reveals paralysis of the gluteus medius and gluteus minimus muscles. Which of the following is the most likely cause of this presentation? All right, I think I gave you guys enough time here. I'm moving on now. If you need more time, please feel free to pause the video. Superior gluteal nerve injury can occur during surgery, leading to the paralysis of the gluteus medius and gluteus minimus muscles. This paralysis results in difficulty lifting the pelvis and performing thigh abduction, abduction, consistent with the patient's presentation. Therefore, the correct answer is C, superior gluteal nerve injury. Moving on to see why the other answer choices are incorrect. Inferior gluteal nerve injury. Injury to the inferior gluteal nerve typically results in weakness or paralysis of the gluteus maximus muscle, leading to difficulty in extending the thigh, particularly during activities like rising from a seated position or climbing stairs. This does not match the presentation described. Sciatic nerve injury. The sciatic nerve innervates the posterior thigh muscles and provides sensory innervation to the lower leg and foot. Injury to the sciatic nerve can result in weakness or paralysis of the posterior thigh muscles, as well as sensory deficits in the lower leg and foot. However, the specific presentation of weakness in lifting the pelvis and thigh abduction is more suggestive of superior gluteal nerve injury. Femoral nerve injury. The femoral nerve innervates the anterior thigh muscles and provides sensory innervation to the anterior thigh and medial leg. Injury to the femoral nerve can result in weakness or paralysis of the anterior thigh muscles, leading to difficulty in extending the knee and hip flexion. This does not match the presentation described. Obturator nerve injury. The obturator nerve innervates the muscles of the medial thigh and provides sensory innervation to the medial thigh and knee joint. Injury to the obturator nerve can result in weakness or paralysis of the adductor muscles, adductor muscles of the thigh, leading to difficulty in thigh adduction, adduction. This does not match the presentation described. Moving on to the next question. We have a patient that presents with difficulty in climbing stairs and rising from a seated position. Examination reveals weakness in hip extension. Which of the following nerve injuries is most likely responsible for this presentation? Alright, I think I gave you guys enough time here. Moving on now. If you need more time, please feel free to pause the video. Injury to the inferior gluteal nerve typically results in weakness of the gluteus maximus muscle, which is responsible for hip extension. This weakness is most noticeable during activities such as climbing stairs or standing from a seated position, consistent with the patient's presentation. Therefore, the correct answer is B, inferior gluteal nerve injury. Let's see why the other answer choices are incorrect. Superior gluteal nerve injury. The superior gluteal nerve innervates the gluteus medius and gluteus minimus muscles, primarily involved in hip abduction, abduction. Injury to this nerve would not result in weakness and hip extension as described in the patient's presentation. Femoral nerve injury. The femoral nerve innervates the anterior thigh muscles, primarily responsible for hip flexion and knee extension. Injury to this nerve would not result in weakness and hip extension as described in the patient's presentation. Obturator nerve injury. The obturator nerve innervates the muscles of the medial thigh, primarily involved in thigh adduction. Injury to this nerve would not result in weakness and hip extension as described in the patient's presentation. Sciatic nerve injury. The sciatic nerve innervates the muscles of the posterior thigh and lower leg, including the hamstrings responsible for hip extension and knee flexion. However, injury to the sciatic nerve would typically result in weakness or paralysis of both hip extension and knee flexion, rather than isolated weakness and hip extension, therefore is less likely to be responsible for the patient's presentation. Moving on to the next question. A patient presents with tenderness and swelling at the ischial tuberosity following a sudden forceful contraction of the hamstring muscles during athletic activity. Imaging reveals an avulsion fracture at the insertion site. Which of the following muscles is primarily responsible for this type of injury? Alright, I think I gave you guys enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. Avulsion fractures at the ischial tuberosity typically occur due to forceful contractions of the hamstring muscles during activities such as sprinting or jumping. The biceps femoris, a hamstring muscle, attaches to the ischial tuberosity and is primarily responsible for hip extension and knee flexion. Therefore, injury to the biceps femoris is the most likely cause of the avulsion fracture described in the patient. Therefore, the correct answer is C, biceps femoris. Moving on to the next question. Or moving on to see why the answer choices are incorrect. Sorry about that. Rectus femoris. The rectus femoris is a quadriceps muscle that crosses both the hip and knee joints. While it is involved in hip flexion, it does not attach to the ischial tuberosity. It is not directly responsible for revulsion fractures at this site. The sartorius. The sartorius muscle is a flexor and rotator of the thigh. It does not attach to the ischial tuberosity and is not involved in the mechanism of revulsion fractures in this location. Rectus abdominis. The rectus abdominis is a muscle of the anterior abdominal wall and is not involved in the mechanism of avulsion fractures at the ischial tuberosity. The tensor fasciae latae. The tensor fasciae latae is a muscle of the hip and thigh, but it does not attach to the ischial tuberosity, therefore is not involved in the mechanism of avulsion fractures at this site. That will do it all for this video, guys. If you have any questions, comments, or concerns, please feel free to leave them in the comment section below. Also would appreciate if you could leave a like and potentially subscribe to the channel. It really helps us grow a lot. So that's all I have for you guys today. This is FixerMed signing off. Have a good day, everyone. Good luck studying, and goodbye.